You are about to meet 6 individuals who are living well on hemodialysis. They are directly benefiting from the active role they take in managing their kidney disease and from their decision to receive their hemodialysis treatments through an AV fistula.
You know, having a fistula has allowed me to lead a relatively normal life and really maximize my treatment.
Since I had my fistula, and I feel so much better that I'm very happy that I did that.
I get up, I got energy. I'm able to do what I pretty much what I want to do.
I need dialysis. What can I expect?
To perform hemodialysis, it is necessary to gain access to your blood system through a vein. This is known as vascular access. There are 3 types of vascular access. They are an AV fistula, a catheter, and a graft. For many reasons, an AV fistula is the best type of vascular access.
What is an AV fistula?
An arterial venous or AV fistula is created by connecting an artery and a vein together in a small surgical procedure. Once matured, an AV fistula is the safest and most reliable type of access. When you begin a dialysis treatment, 2 needles are placed in your fistula. One needle takes blood to the dialysis machine for cleaning, the other returns the cleansed blood to your body. Receiving your dialysis treatment through an AV fistula will improve the effectiveness of your dialysis treatment and greatly reduce your risk of infection.
What is a catheter?
A catheter is an access that is created by inserting a small tube into a large vein in your neck, chest, or groin.
What is a graft?
A graft is created by inserting a synthetic tube under the skin of your arm.
Why did you choose an AV fistula over a catheter or graft?
Well, I'm a triathlete. I do Ironman triathlons. You know, we swim, we bike, and we run. I would not be able to swim with a catheter. You have to limit what you do as far as taking a shower. I mean, there's procedures that you need to do as far as changing dressings and making sure things remain sterile. And you know, during my race season, you know, I swim in lakes and the ocean, and you know, with a catheter, you wouldn't be able to do that.
I chose to have a fistula placed. I liked the fact that it was using my own vein and artery, and that it was a natural form of an access rather than having something foreign placed into my arm.
My fistula, for one, is my lifeline. You just get better dialysis. Your test results come back better. You get a better run, better blood flow. It's just better.
I chose the fistula because I still live a normal life.
What problems did you have with these other types of access?
While I was on the catheters, I had several infections. I was in and out of the hospital many times in a year and a half. Since having a fistula, I haven't had any hospitalizations or infections.
It's a lot of maintenance doing the catheter. You have to be careful with your every move with it. You don't never want those things to come out because you can bleed to death with those.
I really just didn't like the catheter at all because it's inserted in your chest. You can't sleep well at night. 7 or 8 of them fell out. You can't shower. The fistula, you just get better dialysis. Your test results come back better. It's just something I recommend everybody to have if you're on dialysis.
How is your life better with a fistula?
What I can say is this, I think that people look at what I've been able to accomplish. I made history on July 25th, 2004. I swam 2.4 miles, rode 112 miles on a bike, and then ran 26.2 miles. I became the first dialysis patient to ever compete in and complete an Ironman triathlon. And the reason that I'm able to do what I do for a living is the fact that I've really tweaked the process.
Number one, with a fistula, I think you could live long.
Since I've had my fistula, I've improved a lot. The doctor even cut my time down to 2.5 hours, which I like.
What options were you given when choosing your access?
We were concerned about the timing of going to hemodialysis, and the doctor said, oh, well, we can do that fast with a graft. And I, said, fine, whatever. But when it finally came time to do it, the doctor did a fistula.
Well, they said the fistula would be much better, and I'd get a lot better turnover on my dialysis that way, and they feel that I've really got a great one put in there. That's all I hear from everybody that looks at it, is how great that fistula is.
It came to me with 4 different grafts. They looked at my arm and told me, you have good veins, so we want to try the fistula in your arm. And I didn't know until they showed me the graph, the diagram. I was like, oh, okay.
My doctor talked with me about it, said he recommended this would be the best thing for me, is the fistula.
In doing research, patients should, try to find what is going to give them the best quality of life. And I think that a fistula, for me, it's given me that quality of life, and I think it would for other patients too.
Challenges of an AV fistula.
The needles, of course, going into your skin are determined, but the technicians claim that I'm more tender than most, since I jump a little more than most. But I don't regret having needles put in, because I see the people with catheters and not having to have needles placed, and I think they're behind the times. It won't be long before they'll want to get a fistula also.
When I play ball, I have to watch how rough, it depends on what kind of guys I'm playing with, but if you don't think about it, you just, you're in the middle of a battle, you don't really think about, man, if I get hit on my access. And a lot of people ask me that. Do you worry about your access? I said, no. As long as I can hear something moving, blood flow, I'm fine.
There is some pain associated with using a fistula. However, it's only temporary. Once the needle is inserted, I don't feel any further discomfort.
Sometimes it stings a little bit, but you get used to it.
Yeah, the needles hurt when I put them in my arm, but it's all relative. I've banged my shin, and that's hurt a lot worse. So you get used to it.
The arm looks a little different from the way it did before. There's some bumps in there, and this actually is the venal access, and this is the artery. It's all one vein, but they put them together so that it comes out of the artery and back into the vein.
Dealing with a fistula will have some scarring, and so at times I'll wear a long sleeve shirt if the occasion calls for it, but if not, and I notice that people are looking at the arm or the fistula, I tell them that it's used for dialysis, and I just offer a simple, gentle explanation.
I don't hide my arm. In the summertime, I'm more apt to have short sleeve shirts on, and people say, what are those bumps on your arm? So I have an opportunity to do a little sales talk on fistulas.
It's your life. It's either the needles or you could die. And you got to think about that. This is your life. And either it's going to be a little pain that's going to last for 3 or 4 seconds, or you could die.
Yeah, I deal with it. I figure that's the way it's got to be.
What do you want to tell others?
I have a fistula. I've found ways to make dialysis work for me. And I think, all patients can do that. They can take a more active role in their treatment and really try to streamline the process.
If a patient were to ask me, why do you go to all the trouble? Why would you have the pain of having the needles put in your arm and have those ugly bumps on the arm? I don't think they're so ugly myself. Why couldn't I just have a catheter where I'd just be hooked up, plugged in, and that'd be it? I'm not sure exactly how I'd say that's your choice, but you do run the risk of infection and inadequate dialysis.
After 27 years of being on dialysis and using a fistula, I know that that's the best access.
This is what I want. This is my life. And if your doctor can accept that you pushing him for a fistula, then maybe you need to find another physician.
You know, I understand being afraid, but I think that as a patient, you want to, it's about quality of life, and you want to get the best possible treatment and be able to have a quality of life that you had before you got sick. And with a fistula, I've been able to do that, and I think that other patients would be able to also.
Do the right thing, take your meds, stay with your diet, do right, watch your fluid intakes, go to your treatment, be on time, and take your meds. You can live longer. You can live on dialysis. It's up to you.
You should have the fistula put in, because sooner or later you're going to have it done, and you get a lot better results out of it, because it isn't that bad. It's not bad at all.
I'm pleased we've been able to share the collective wisdom of these hemodialysis consumers who are using a fistula. You are the most important person on your healthcare team. You know your body better than anyone else. It's your life. Take control of it. And remember, when the time comes for an access, request a fistula first. Take care.
If you have questions about vascular access, consult your healthcare team.